So how do doctors diagnose cancer? How do we identify if something that we are seeing or experience is due to cancer? So most of the times, cancer takes the shape of a tumor in case of solid tumors of the organs of the body. And when it is blood cancer, it is in a different form. So coming to solid tumors or tumors that are formed inside the different parts or organs of the body, we diagnose it by taking out the sample or a small portion of that tumor and we examine it under the microscope. So you would say that doctors would suggest you to go for biopsy. Biopsy is what? Biopsy is when we take a piece of that tumor and examine it under the microscope to see if it has features of an abnormal cell that was dividing fast and forming cancer. So that's the most important thing to establish diagnosis of the cancer. There are situations where we cannot take out the tissue sample. If the tumor is very deep seated, if it is in a very critical location, trying to take sample might cause more harm, then we go by the scans that we do. So, but before we go to biopsy, it's important to also understand how do we evaluate any suspicious thing that we believe could be due to cancer. So we might do an ultrasound scan or an X-ray of that part, or we might do a CT scan, and if we find a tumor somewhere in those scans, we would try to take a sample through biopsy, and through the biopsy we are able to establish the diagnosis. Once we are able to establish that this is cancer, we need to do other things to know about it more, so that we are able to understand what type of cancer it is. As I said before, it is more than 100 disorders. We need to know what's going on inside. What is the nature of that cancer? How aggressive it is? What are the genetic or genomic factors? What are molecular factors? Whether it has spread. We need to do staging. So that's how we diagnose cancer first. Do the scan, take the biopsy, then we do other tests like immunohistochemistry, like the genetic testing, genomic testing on that tumor sample to ascertain the nature of the cancer that it is. We use PET-CT scan, which is done from head to toe, every part of the body. We scan it and we kind of try to understand if the tumor has spread to any other organ inside the body. This helps us identify the stage of disease, because unless we know what cancer it is, what is its stage, we cannot devise a treatment plan to address or to try to cure it.